All right, welcome to Advocates for Truth, where we discuss the intersection of truth and opinion. And we're excited today to have Dr. J. Bhattacharya. He is an amazing man and friend, someone I've come to know over the last few months. He is our expert witness on many cases that we are involved in. He is an expert all over the country working as it relates to COVID-19. Here's some, I'm just going to give you, you have to hear about these things. He is a professor of medicine at Stanford University. He's worked there since 2001, and he's an MD and a PhD in economics from Stanford. He is the director of the Stanford Center of Demography and Economics of Health and Aging, teaches on health economics in the economics department, and advanced statistical methods in the School of Medicine. So how many people do you know can teach in economics and medicine at the same time? Amazing. So he's published about 136 articles relating to epidemiology and infectious disease. And so it's great having you. I have Neal Hardin here with me again today. So boy, Dr. J, as I like to call him, because his last name can be difficult sometimes. I did pronounce it right, didn't I?
You did fine, Bob. No worries.
Well, so here we go. First of all, what is an epidemiologist?
So it's someone who studies disease, how disease spreads, the patterns of disease, the causes of disease. That's basically it. The statistics of disease and the statistics of how disease can best be controlled, managed, treated.
So today our goal is to talk about COVID-19 and bring the truths as to COVID-19, the risks, and really what's happening. We're here facing people telling us that we're about to see another lockdown here in the United States. I hear of lockdowns internationally that are going on elsewhere, and we want to get the truth out in regard to what's happening. Let's try to get to the point where we're not just focused on opinion, but we're focused on truth. And we want to look at things through a biblical perspective on this. Another awesome thing about Dr. J is he is a Christian man, teaches a Bible study. He's involved with the church as well, and actually in leadership at his church. And so what a wonderful man. And so Dr. J, what's it take to become an epidemiologist?
Well, I normally it takes a PhD. You have to do a PhD in epidemiology. That's the typical path. My PhD, I have an MD and a PhD in economics. When you're studying for your MD, you also have to learn some epidemiology. So for me, it's a little bit of a non-traditional path. As the medicine, where I learned about epidemiology, the economics, where I learned about statistical methods, and then I spent a lot of time just writing on various diseases using epidemiological methods and statistical methods. So I do epidemiology, but I didn't take the traditional path in, if you will.
Well, you sure seem to have the experience behind you to be able to address all these issues, obviously, right?
I try.
Let's jump to statistics. So the risk of death, this is ultimately where I think it all comes down to COVID-19 and what are the risks associated with COVID-19. Neal, you come from a younger perspective. You are a millennial. That's the word I'm looking for, right?
Yep.
And it seems as though there's a big difference between millennials and a lot of others as it relates to risks and what kind of risks we're willing to take between the different age populations, frankly. Just the other day, we were up in Santa Clara and we were doing a press conference at San Jose Calvary Chapel. And we had these two little older ladies come up. I'm guessing they were, late 70s, maybe even early 80s. came up and kind of hobbled up to the front and got in front of the television cameras and said, you know, this church is important to me. I don't want to sit back and just stay in my home. This is where I have life. This is where I enjoy. I'm not going to stay home. I need to come to church. And we're willing to take the risk of death. And they're in that most risky population. And it seems a lot of millennials, on the other hand, are more saying, no, we can't take these risks. What do you see, Neal?
Yeah, and there does seem to be a definite divide between those who are older and those who are younger. And I think it probably comes down to, who do you believe? Who do you put your faith and trust in? I think a lot of the younger people tend to be more trusting of the government and government statistics that they put out. And they say, you know, there's a high risk of this. Then they say, okay, well, I don't want to endanger anyone who might be elderly. I don't want to endanger someone who might be more at a high risk when I'm at a low risk. So I think that's maybe where a lot of people are coming from my age.
Well, let's talk about some of the statistics, and I'm gonna I'll read from a declaration that Dr. J signed and put into evidence in court when the County of Santa Clara came against one of our clients, Calvary Chapel San Jose, seeking to get an injunction to prevent people from going to church indoors and from singing. So here's what his declaration says in terms of the statistics for Santa Clara County. And he looks at this and says that the survival rate for people between 0 and 19 years is 100%. Speaking of Santa Clara County. And for people between 20 and 39 years old, the survival rate is 99.987%. Again, 99.987% for people between 20 and 39 years old. And Neal, those are people in your age group. And then for people between 40 and 69 years old, the survival rate is 99.84%. That's people in my age group. And then for people who are above 70 years old or 70 years and older, it's 98.7%. So I'd like to ask you, Dr. J, those statistics for Santa Clara, how do they compare to the rest of California or the rest of the nation?
So those statistics are from a study that I ran earlier in the epidemic in April. And in Santa Clara County, the way we get those numbers is you look to see how many people show evidence of having been infected. It turns out that that's a lot more than just the number of people you see cases, right? So the cases you see in the United States, I think it's like somewhere on the order of 7 to 8 million cases so far in the U.S. thus far identified. If you take into account the fact that each case is there's many more people infected that don't show up as cases by looking at antibodies in their blood, for instance, in a population survey, you can find that probably on the order of 10 times as many people, 70 to 80 million, maybe even 90 million people in the United States probably have been infected. That teaches you a few things. So one is that the disease for a few people is absolutely deadly, right? All the images we see on TV are the people with the viral pneumonia, but for maybe somewhere between a third to a half of the people that that are infected have no symptoms whatsoever. And for the majority of people, it's a very mild illness, so mild that they don't even go to the doctor to take care of it. For a few people, it's absolutely deadly. The other thing that we learned from that study is that there's this sharp divide by age, as you mentioned in your statistics. The older population faces a much larger risk if they get infected than the younger population, right? So in Santa Clara County, up through April, no children had died. That's why the 100% survival rate.
Yeah.
Worldwide, it's not 100. I mean, the kids can die from this. That's absolutely true, but they die at very low rates. In the United States, for instance, for people under 18 and under, more kids this year have died of the flu than have died of coronavirus.
Now, can I ask you a question? So you said that the number of cases might actually be 10 times based upon people who were asymptomatic or who never got studied, who never got tested, I should say. The rates that we just quoted, so for example, for persons 20 to 39 years old, 99.987%. Does that factor in this, the fact that there may be 10 times the number of people that have actually received or been infected with coronavirus?
Yeah, that does factor that in, right? So there, even the studies that we did, which look at antibody in the blood, that also still might be an underestimate, because it turns out that antibodies fade over time. So you get infected and eventually the antibodies go away. Although your immune system still is primed to respond to the disease, you're still in some sense protected. It's just the antibodies themselves are no longer present. You have other cells like B cells and T cells that provide you some immunity or some protection against reinfection. So the antibodies could actually be an underestimate of how much immunity there is in the population. If you look at worldwide data, Santa Clara County and LA actually have done better than much of the rest of the world. Actually, so in the rest of the world, the survival rate for people under 70 is 99.95%. So if you get infected, 99.95% of the time you will survive the infection. If you're under 70, for people who are over 70, it's something on the order of 95%. So 5% of the time you'll die. 95% of the time you'll survive if you're for the infection.
That's based on worldwide statistics.
Yeah, 50 different seroprevalence studies now been done around the world, and that's a paper that was put out just recently by the World Health Organization, the Bulletin of the World Health Organization, compiling all of those numbers together to get those numbers I just quoted to you.
So just to summarize, then, so the risk of dying if you're over 70 years old worldwide is about 5%. And that is if you contract coronavirus.
That's right.
What is the actual risk of contracting coronavirus? Because it's not as though 5% of the people over 70 years old are going to die. It's going to be 5% of the people over 70 years old who catch the coronavirus, right?
That's correct. The answer to that question depends on policy, right? So a policy that protects the older population from getting infected will do a much better job at keeping mortality rates low than a policy that lets older people get infected.
Do these statistics from the WHO also factor in the people who have contracted coronavirus but have never been tested?
Yes, yeah, they do. They're based on those seroprevalence studies that look for antibodies in the population. So and there's, like I said, 50 now of these studies worldwide. So that's where they're getting those numbers. It's also why the numbers that we're talking about seem so much better than maybe the impression you might get from listening to the TV or looking at the newspapers.
Yeah.
The newspapers don't generally account for the fact that there are many more people infected than identified as cases. They just focus on the cases. The cases very often tend to be people who are more severely ill. That's who shows up to get tested in the first place, right? And so that's why the impression you might get from TV is that it's much worse. But even if you just focus on cases, the numbers have gotten way better since March or April. In March or April, in Santa Clara County, something like 10% of people who were cases died. Right? You get a coronavirus diagnosis, and 1 in 10 wouldn't survive.
Mm-hmm.
I'm not talking about people who are infected and don't show up, just people who show up for the hospital because they're severely ill.
Yeah.
Now it's something on the order of 1%.
Wow.
The treatment's improved quite a bit since that's one very, very important part of that. We're also picking up more. We're testing more, so we're also picking up milder cases than we used to in March and April. So combine those two things together, I think so there's a distinction in epidemiology between something called an infection survival rate. That's what we've been talking about up to now, the 99.95, and a case survival rate, right? So the case survival rates among the set of people who are identified as cases, what's the survival rate? And that's improved from 10% in Santa Clara County in March and April down to 1%. Since the survival rate's gone from 90% to 99% among the cases. That's
Okay.
basically what happens is after you've been infected, your body attacks the virus with its immune system, and the virus is based. If it's successful, the virus may still be there in fragmented form. The PCR picks up the virus fragments, but those virus fragments are not infectious virus fragments.
So how many cycles are being used across, let's use the state of California particularly?
I think different labs have different numbers, but I think most of them use way more than 30 cycles or 32 cycles. I mean, some of them I think are using up to 40 cycles before they declare negative. Now, I could tell you, like, it's not necessarily bad. There's a trade-off in these kinds of tests between false positives and false negatives. Right. So if you're using the test to check to see if someone should enter a nursing home, I want to be very conservative. I don't want to take any risks in a nursing home because, as we said, older people are very susceptible to mortality if they get sick, right? So I want to make sure that someone entering a nursing home, even if a lot of it's false positives, I'm willing to accept that false positives in order to make sure that I capture every single true positive. There's a trade-off in this. If you decide 32 cycles, you may actually end up having some false negatives, which would be terrible in a nursing home setting. On the other hand, someone who's, you've opened up your school and you test a kid, and now because you have a false positive, now you're going to close the school down. Well, the cost there is really high. You want to make decisions about these thresholds to match with what you're going to use the test for.
Sure, that makes sense. How about across the country? Do you have any knowledge as to how many cycles are used kind of on a nationwide average?
I don't have data on that. I don't know of any data source that has compiled all of that. My sense from the numbers that I have seen, which are not representative, but is that almost always it's somewhere on the order of 35 to 40 cycles.
Okay.
More than the 32. But again, I don't have firm numbers for across the country for that.
So if that's the case, let's say it is 35 to 40 on average. How is that misinforming? Is it misrepresentative for purposes of establishing public policy?
Oh, it's terrible, right? Essentially, it creates panic because you have a mix now of people who truly are infectious and that pose some epidemiological danger, and a lot of other people who are not infectious pose no danger, and yet drives panic among the population at large, and that which then turns into disastrous decisions about closing schools, closing businesses, closing churches, closing, sort of locking down.
Has the cycles had any impact in, as far as as it relates to the public policy of shutdowns right now?
Yeah. So for instance, our in California, well, we are now familiar with these color tiers, right? So I forget the color scheme, but it turns out there's no green because we can never go back to normal, apparently.
Can I just say real quickly, so for people outside of California, the governor of California and his, folks have established this tier level. So you start out at the highest risk, it's purple. And then you can drop down if the numbers get better, and you drop down into red, and then it drops down to orange, I think, and then down to yellow. By the way, as you just said, there's never a green, because at the press conference, Governor Newsom said, we'll never get back to normal. Scary thing, but go ahead.
Okay, so what are those numbers that they're premised on? They're premised on the number of cases per million population, and on the percent positivity of the cases of the tests. This is the PCR test that we've been talking about. So the cases then are just how many people are positive over the last 7 days that you found that are in your county. Well, those cases, as I said, it's a mix of people who are infectious and who are not, because it depends on the cycle time. Like, a scientifically justified criteria would premise the thresholds on the cycle times, because we know from the scientific evidence that if you require more than 32 cycles, you're probably not infectious. You want to premise reopening on infectivity risk, not just on cases that may or may not be infectious.
Right.
Same thing is true for the cycle. Actually, the percent positivity number is an even worse number, because who gets tested? Well, in the early days, it was really sick people who got tested. So of course, a large fraction of those tests would be positive.
Yeah.
Now we test people who are, we test schools. We have that number has nothing to do with epidemiological risk. That
So
percent.
let's talk about the false positives, I guess it would be.
Functional false positives, I like to say.
Functional false positive?
Yeah, the reason functional is because the virus is there. It's just a virus fragment that's not infectious. So it's a functional false positive.
All right. So for the number of people in the state's basing whether or not, the state is basing in part what tier a county falls into based upon how many people test positive. And that positivity rate is not really accurate, because that positivity rate includes a ton of people who are not actually infectious. So let's say, I've heard numbers anywhere on average, these labs are testing or cycling 38 to 40 times. But let's just say that, they're on average, I think you were suggesting maybe 35 to 40 times instead of cutting it off at 32 cycles. If they are testing and amplifying 35 or more, what percentage of the people who test positive are actually not even infectious on average?
It's a very high fraction. I mean, it's a very high fraction. I can't give you a specific number because I've looked at it. I haven't seen the paper that's quantified that directly. It's something on the order of 90, more than 90% is my best guess, but that I've still been unable to fully quantify that.
So that's just shocking. Here we are, and we are in California right now because, the November's hitting or December's hitting, it's coming, the winter's coming, and we're talking about the closing down. We've had 3 states fall back into the purple tier. We've had other counties, other counties in California fall back into the purple tier. We've had other counties go from the orange or yellow tier back up to a higher tier, into the red tier. That means shutting down businesses. That means for those counties that are going back into lockdown, it means shutting down churches. It means people just losing so much, and that's just crazy. Does that, Neal, what do you think from a perspective of a younger person? I mean, what are your thoughts about it? Is it shocking? Is it, do you think this is going to make a difference, this real information?
I mean, the statistics we're talking about, it should make a difference. We need to be basing these decisions off the actual risks that are being posed and not merely, hyperbole or just, just what people are saying. We have to actually look at the data. And that's why I'm glad we're having this conversation.
And so Neal hasn't really been, you've not been privy to this stuff that I've been working with Dr. J for months now. And I've seen a lot of these statistics, and we've wanted to get this information out. You haven't heard any of this. Mm-hmm. How does this change or impact your mindset about the coronavirus?
I think it would be helpful to ask Dr. J here, what are some of these, what are the risks posed? What are equivalent risks that we take in our everyday lives that, yeah, that most people do without even thinking. Because I think that would make a big difference to someone like me or someone my age. It's like, if these are about the same risk as getting infected or dying from coronavirus as we do from something else, then, how do we look at that?
That's a great question, Neil. So just let's take that number that we talked about earlier, that the survival rate from coronavirus infection for people under 70 is 99.95% or 0.05% fatality rate, right? If you drive something like 30,000 miles a year, you face that same risk. Actually, for you, Neil, you're younger. You only need to drive 10,000 miles a year and you face that same risk.
That's right. We're reckless.
Wow.
Yeah.
Wow. Think about that. Yeah. So because the younger you are, the more likely you're going to get involved in an accident.
And also the coronavirus infection is less deadly for Neil than it is for me. So it's 0.05 for everyone under 70, but for kids, it's almost zero. For someone in their 20s, it's 99.995, right? So it's survival even better, 0.05%. I mean, it's increased. The survival rate is decreasing with age very sharply. So for Neil, who's 20, he faces a very low risk if he should get infected for dying. I'm 52, I face a higher risk. Overall, for under 70, it's 99.95 survival. So it's like driving 10,000 miles for you, maybe driving 20 or 30,000 miles for me, right?
So what are the risks of actually transmitting the disease? Because it sounds like the risk of dying from the disease is very low, but I think something maybe younger generation worries about is what is the risk of actually transmitting it to someone who potentially does have a higher risk of dying from it?
Yeah, so that is something you should worry about. That's absolutely something that's worth thinking about. Because as we said, not for people who are in their 70s or higher, it's a much higher. I don't want to infect my mom. She's 80. And so I'm much more careful around her than I am around my kids. So I think that's something that's worth thinking about. In fact, that's the basic idea for what I think the right policy should be. We should work very hard to protect older people and people who have certain conditions that make them at higher risk.
Let's get into that in just a second. Can we ask a couple other questions about comparable risks? Because I want to get into the Great Barrington Declaration and policy that you guys have you've recommended along with some other experts. So first, another question is, how about the flu? That's been thrown out there. Can you compare the flu to the varying age groups and risk of death?
Sure. This is more deadly on average than the flu.
Okay.
But that's misleading because the age difference in flu mortality is not as steep as it is for coronavirus. So for younger people, the flu is more deadly. The cutoff, I mean, depends on the estimate you look at, but let's say age 35 and below, I'd say the flu is more deadly than coronavirus. Could be 40 or below.
And the CDC actually has statistics out for people under 18 that came out, I don't know, a couple months ago that showed significantly more, almost double, if I remember correctly, double the number of people have died from the flu than died from the coronavirus for those under 18.
Yeah,
right?
For kids, the flu is more deadly, absolutely more deadly. It has always been more deadly.
Okay.
And yet we keep our schools open despite this risk of the flu. If for people who are over 70, the flu is much less deadly, right? So it's complicated, and again, the key fact: older people, coronavirus is really bad. For younger people, it's much less bad. So that's really important. Actually, can we talk before we head over to the policy? I want to say one other thing about some of the risks that we face, and that actually has to do with the policy itself, right? So younger people, we've locked down our society, right, in many ways. The risks that they face from these lockdowns are absolutely devastating and enormous. The physical and the psychological risks are enormous. So the CDC in June estimated that 1 in 4 young adults had seriously considered suicide this past June. 1 in 4. People have skipped cancer screening. So women will show up with stage 4 breast cancer at much higher rates this coming year as a result of our lockdowns. People have skipped colon cancer screening, right? We'll have more colon cancer deaths. We'll have people have skipped diabetes management visits. We're going to have, and we're already starting to see a huge number of excess deaths more related to the lockdown than to the virus itself. And this is especially bad for young people. For young people, essentially, these lockdowns are much more deadly than the coronavirus infection itself.
Wow. And, you know, one of the things I wanted to address is what's happening outside the country. We'll get to that as well. You know, you identified a study that just came out, I think you said yesterday when we were talking earlier before we started recording, and that was 3 months of missed schooling translates to just a ridiculous amount of deaths. Can you address that?
Sure. Yeah, this was
I'm sorry, not deaths, but a number of years lost. Go ahead.
Yeah, let me explain. So like you know, we basically closed our schools around the country in March of this year. Kids basically had to go to online, or I mean, it was very hit or miss, and a lot of kids actually missed school altogether as a consequence of this closure. There was a study published yesterday in the Journal of the American Medical Association that found that, so here's a fact, it's not less well known, but should be known. Each year of schooling, each additional month of schooling actually translates to improved life expectancy. Investments in schooling are incredibly productive for health. So kids who basically stay in school, they have better health their entire life as a consequence of it. Right, they're lower diabetes rates going forward. They're less likely to be obese. They're higher income. They just have better health outcomes. Schooling is an incredibly good investment. Mm-hmm. In not just in terms of like money, but in terms of like health. It's a great investment in the future health of our population. Right, so you should, all you out there that are listening, you should thank your teacher because they've made you much healthier as a result of it. What this study found is that those 3 months of closure in April, May, and June, or March, April, May, or whatever, those 3 months of closure has led to 5.5 million lost life years on average, years of life expectancy on average for the American kids.
Wow.
5.5 million. That's more than the life years lost from coronavirus through those months. We basically, if that result holds up, and it seems, I mean, you guys published in a peer-reviewed journal, top peer-reviewed health journal in the United States. If that result holds up, then essentially we have put an enormous burden on our kids to control the infection. As a way to try to address the spread of the disease.
Yeah, and burden on them.
Didn't actually end up controlling the spread of the disease, as you can probably see through the whole country. The disease is still spreading. Right? I think 70 or 80 million people have already probably 80 million people have already got the disease in the United States.
Wow. You know, one last comparison. A week or so ago, you and I were talking, and I raised a statistic that I found on the national statistics website. And it said that 1 in, I believe it was 113 people who fall will die from the fall. And that's, you know, physically falling down. I kind of, you know, laugh. I think to myself, okay, well, let's stop walking because of, you know, the risk of falling and dying. So we stop walking, we stop driving, we stop doing so many things. We don't get our hip replacements when we need to, or our knee replacements, or, you know, there's so many other statistics that can be found. It seems to me that there are innumerable comparable things that we do in everyday life that is accepted that is equally, or if not more dangerous than the coronavirus. Would you agree with that?
Absolutely. I mean, I think one of the absolutely, I mean, to me, just like shocking things. I think people, when they start listening to the coronavirus death statistics, the sense I get is that people um, have never confronted the fact that we face risks all the time in our lives. Like we cannot ever, I mean, just by dint of being alive, we face the risk of dying.
Yeah.
Believers understand that, but maybe we don't understand that in the deep way that we ought. Um, we have no choice. I mean, just the fact that we're alive means we're going to have to face risk. The question is, what do we do to mitigate those risks? Are those reasonable relative to what other things we want to do with our lives? Maybe there's something we can come back to later when we're talking about scripture. But I think that idea that look, there are mortality risks out there, I think came as a shock to many people.
Yeah. It's like, wow, people actually die. You know, and one of the things, Neal, how often do you get something on your phone? I mean, where do you get your news from?
All over the place. I like to go on Google News and just read from all the different sources.
Do you watch television?
Nope.
No television. So you get it basically from the internet for the most part.
Yeah.
Okay. How many times a day are you seeing how many people have died from coronavirus in the news?
All the time. I mean, right now the media is fixated on cases. It's like, we're having rising cases, but every time I look at the death rate seems to be going down, but cases continue to go up. So, and media seems to be fixated on all the new cases. Like it reported Texas and California have surpassed 1 million cases.
Yeah.
But it sounds like what we're hearing is that cases isn't necessarily the best number to base public policy on. And
every time I turn on the news, so, a little older, if I get a chance to get home early enough, I'll, click on the news, and it seems like every time I turn on the news, on television, that is, first thing that they talk about is how many new cases across the country, how many new deaths across the country. And that seems to be popping up on my phone all of the time as well, in all of those websites. So to me, I'm calling it the propaganda of fear. And the reality of it is it's misinformation, because people are looking at those numbers and they seem so high about, how many people have died from the coronavirus. Yet, okay, well, let's realize how many people have actually died from all the other causes in life, whether it be cancer, suicide, horrible things, car accidents, all of the other ways people actually die, which, it's not that we want to promote that as such. It's a great thing. People are dying from all these different ways. But the reality of it is, comparable when comparing coronavirus to how people die in so many other ways is not great. But I think it's this propaganda of fear. And one of the ways, Dr. J, that you guys have really come out, and I say you guys because I want to talk about the professional community, have come out and tried to counter that, is through the Great Barrington Declaration. And I think it was about a month ago, you got together and you were with some folks like yourself, and Dr. Sunetra Gupta from Oxford, Dr. Koldorf from Harvard, some great experts. And you guys created the Great Barrington Declaration. And by the way, it's at gbdeclaration.org. Go read it. 11,930 medical and public health scientists have signed on as of this morning. 34,426 medical practitioners have signed on as of this morning. So can you tell us, what is the Great Barrington Declaration, and how did this come about?
Sure. The idea of the declaration actually is premised on things that we've already talked about. This disease is deadly for older people and less deadly for younger people. By contrast, the lockdown is absolutely devastating to the younger population. The lockdowns, I think, are an irresponsible use of power, because we've basically asked young people to face enormous harm in hope of protecting older people. I think it's irresponsible to use people instrumentally like this. But even apart from that, it's not ineffective. We haven't protected older people. The idea of the current policy is that we slow the spread of the disease, and so older people face less risk, right? That has not worked. I think something on the order of 70% of I don't know the exact number, but like something on the order of 70% of people who have died to date in the U.S. are over the age of 60. We have not protected the older population. So the Great Barrington Declaration says we should do two things. One is we should take concrete steps. We call it focused protection of older populations. So for instance, the stuff we have started to do much better, like protecting nursing homes, use testing resources, PPE, all the sort of traditional things, reduce staff rotation in nursing homes, so make it so that visitors have to get tested, things like that to protect to make it so that the disease doesn't spread in the nursing home population, because that's I think 40% of deaths have been in nursing homes.
Yeah.
So the second thing is in focus protection. We ask 63-year-old bus drivers, 65-year-olds with diabetes but they're Costco clerks. We say, look, go out and expose yourself, get exposed to all these people, even though we know they're vulnerable. We call them essential. It's like this Orwellian term.
Essential workers.
Essential workers. Basically, it just means you're poor and you have to take that risk, or else you can't feed your family.
And so you talk about the disproportionate impact on the working class, the poor, the working class, et cetera, of these lockdowns. Love to hear more about that.
Yeah, I mean, I think a compassionate policy would say, look, these folks are vulnerable. They actually are high risk. Let's use the trillions that we spent so that they don't have to, that we can do some alternate arrangements so that they can keep their livelihood but don't have to work and get exposed to the virus, right? We have a law called the Americans with Disabilities Act. Let's use it so that we have reasonable accommodations for people who are at high risk. So if you're a 62-year-old teacher, maybe you don't have to teach in person, but you can go, you can help younger teachers prepare curriculum or grade tests or whatnot. Provide alternate arrangements for people who are at risk. So those are the basic ideas for focus protection. There's more ideas I can give you, but the idea is to protect the vulnerable.
Yeah.
As much as we can. Use all our resources and ingenuity to protect the vulnerable. And for younger people for whom the lockdowns are worse than coronavirus, let them free. Let them go back to their lives. Open up our schools, open up our businesses, open up our churches, open up society. Now, that's not to say that people won't take protection. I mean, people are still going to be nervous, and if wearing masks might make sense in crowded situations, you should wear masks in crowded situations. You can social distance if you need to. I mean, all those standard precautions people will take, even if you don't tell them to now, young people. But you shouldn't force close all of those things as thinking that we're protecting the older population when we're not. And in fact, we're harming the younger population as a consequence of those closures. Open up society.
And it seems that, when you look at what's happening, we're talking about these lockdowns. Who are they really protecting? They are protecting the professionals in office settings. My office shuts down because we're forced to shut down. And so most of the people here, we've got lawyers, we've got paralegals, they're professionals, and we can all work from home because we work, we've got our computer, we've got internet technology, we have all of that. However, for, during this lockdown, who had to go to work? It was the people in the quote unquote working class, those folks who are, like you said, the cashiers, the greeters at Walmart, the people working in manufacturing and assembly to make sure that, we get our food and our distribution and our supplies. And what it seems like to me is it reminds me of the movie, what is the Mockingjay movie? I keep forgetting.
Oh, Hunter Games?
The Hunter
Oh,
Games.
sorry, Hunger Games.
The Hunger Games, where you have this elite class who's enjoying all of the food, enjoying the decadence, and yet at the same time the working class, the poor, are impoverished. They're out, trying to survive. And they're the ones who are being really impacted. I don't know. Is that a fair comparison, do you think, Neal?
I mean, I think Hunger Games is a bit more dystopian than
Come on.
than what we're going through.
Maybe a little bit, but
but I think it does at least draw a comparison between, those essential workers, those people who don't have the option of being able to stay home versus those who have the option to stay home, that there's a definite divide there.
I guess my real point is trying to get back to, if we really want to be compassionate, if we really want to care for the poor and bring justice, the way the government in California and throughout the rest of the country is handling this just doesn't seem to be the way to do it, is it, Doctor?
I don't think so. I think that the policy that we have adopted, I mean, it violates every value I have, every single one. The policy we've adopted has devastated the poor. It hasn't protected the elderly. It's exposed the vulnerable in many ways. The policy that we've adopted, it violates principles of public health, right? So we've created this environment where if anyone gets the disease, we shame them. Oh, it's your fault, you got it. Well, I mean, like one of Jesus's great revolutions was to destigmatize disease. He reached out to the lepers, and now there's no outcast. These are just fellow brothers and sisters that we have to care for, treat compassionately. Public health has always had that, I thought, as its basis, treating the sick compassionately, not blaming them. And yet we've adopted this idea that if you get the disease, you're weak. You didn't follow the rules. Therefore, you got it. I mean, it's a virus. You can get it whether you follow the rules or not. It just happens, right? It's not. We made this mistake with HIV, where we blamed people for getting HIV. It was a mistake. It was an enormous mistake. We stigmatized the disease. We created this sense of shame around getting the disease that public health should never do. We've used panic as a tool to control people's behavior. I mean, just this policy that we are currently following violates every norm I've ever thought about, ethical norm I've ever thought about in public health, and of course my own personal norms, ethical norms that stem from my Christian beliefs.
I heard from one epidemiologist a number of months ago. I talked to him, and he said everything that we are doing, these lockdowns, violates Epidemiology 101. It's contrary to everything we've studied and learned, to the plans that we've had to deal with disease. Is that right?
Yeah, that's right. I mean, I think before in the last century, the way we've dealt with these epidemics that have come up, every 10, 20 years, or more frequently, involve not sowing panic, giving people a sense of perspective and accurate information. You don't disrupt all of society to focus on one thing, because when you do that, all the other things that society does that keeps people healthy and alive gets lost. This is a complete reversal from standard practice in epidemiology for dealing with respiratory diseases like this.
Wow. Let's talk about herd immunity. I read on your on the Barrington Declaration website, to ask an epidemiologist, do you believe in herd immunity, is like asking a physicist if they believe in gravity. Those who deny herd immunity may also wish to join the Flat Earth Society.
I think maybe we shouldn't have said it quite so strongly, but it is true. It's just a fact. It's a biological fact. What is it? It's not anything magical. What herd immunity means is, and you have to talk about it whenever you're talking about infectious disease control, right? So what it means is, when there's a sufficiently large fraction of the population that's immune to a disease, when someone new gets the disease, and they randomly interact with people in the population, they're unlikely to spread it very widely because there's so many people that interact with are already immune. That's just so lots of diseases are controlled by this. So Zika, for instance, is controlled by herd immunity. The other human coronaviruses are controlled by herd immunity. These are diseases without vaccines that are controlled by herd immunity. Measles is controlled by herd immunity that does have a great vaccine, right? So you can get the immune population either by natural infection or by vaccines. Obviously, we prefer vaccines, but the fact of herd immunity is true whether you have a vaccine or not.
So on your way to herd immunity, it's not the idea of saying let everybody just go about their normal business, right? I mean, there's some level you still want to protect the vulnerable while you're at it.
Yeah, I mean, the only question about herd immunity is not will it happen, because it will. The only other alternative to that is zero COVID, and that's impossible. We can't wish it away. So the only question then is, how do we minimize death, human misery, and harm on the path there? That's the only question. And the two policies that we have in front of us are lockdown or focused protection. Those are the only two policies available to us, actually, that I've seen that are at all reasonable.
But the government's pretty much chosen lockdown.
Yeah, it's chosen lockdown. I mean, it's interesting, like the new vaccine that's come out, or that was just announced, actually it's a great tool for focus protection. So I mean, the government in the United States has got, I think, something under 50 million doses for this new vaccine already manufactured, already on order.
Wow.
With Operation Warp Speed. If the FDA actually does find that it's safe and effective, it's a great tool for focus protection. We provide all the vulnerable people with the vaccine. My mom, my 80-year-old mom, will take it. Yeah. Not me, because I'm not at risk. I'm a much lower risk than she is.
Yeah.
And then I can interact with her safely.
Do you have any thoughts on this Pfizer vaccine in terms of, whether people should take it?
I haven't seen the data yet, but the news reports are very, very promising. If the news reports hold up and the safety data look good after I look at it, I think I would absolutely advise my mom to take it, for instance, first, and then later for me to take it when there's a sufficient dose.
Okay. Let me jump to another subject, because we're getting long here, but this is so important stuff. The WHO came out with a study, and they estimated that 10,000 children per month are now dying as a result of the lockdowns from starvation throughout the world, particularly in third world countries. I saw an estimate, 128,000 young children will die over the first year of this virus as a result of starvation. It's been quoted to be a global famine of biblical proportions. And it's coming from these humanitarian agencies that are not able to get out and be able to distribute food, and these travel bans. There's an AP article that was written on July 27, 2020, and I'll quote, "In Sudan, 9.6 million people are living from one meal to the next in acute food insecurity, a 65% increase from the same time last year. And inflation hitting 136% for prices for basic foods that have more than tripled because of the lockdowns and the fact that they can't get out and sell onions and their food in the marketplaces." And, it's so easy for us to focus here on the United States and what's happening to us. And here's where, at Advocates for Truth, and our goal is to not just have this singular focus, because Christ would not want us to be focused only on what's happening here in our little world of the United States or California. But to me, it kills me, because we have some friends in Honduras. We fostered a little girl from Honduras. She's back. She's 6 years old. She's back in Honduras with her family. She is in a situation where they just got devastated by a hurricane. They've been on lockdowns, and the crisis there is just unimaginable to us. And here we are, we're focused on what we're trying to do in the United States in particular to protect life, to protect the vulnerable, to protect everybody, frankly. And we're using these draconian lockdowns that's having this worldwide impact, because I know for myself that we've been wanting to get down to Honduras to go and be a part of some missionary work and help with food distribution, et cetera. And we haven't been able to do it. We usually would go to Haiti almost once a year, and that isn't possible. And meanwhile, what's happening throughout the world is this famine of biblical proportions. What are your thoughts, Dr. J?
I mean, I saw one estimate, I think it was in April or May, that 130 million additional people will starve as a consequence of this lockdown, of the economic collapse caused by the lockdown.
Yeah.
I mean, I think very often we think about, it's been framed like, well, it's just money. You trade off the money for lives. The lives are more important. If you're living on $2 a day, the world's biggest economic engine has an enormous hit to growth. Your trade in your country goes down, food prices go up. Those $2 a day no longer go so far. You will starve. 130 million people. It's not just money. These are lives of people, brothers and sisters that we've been talking that we have some responsibility for, I think. And I think we should work very hard to try to. If y'all donate money to this. I think that's really, really important, because I think that consequence for every poor person on every poor country on earth is happening now and will continue to happen as long as these lockdowns last.
I saw a picture in the Washington Post, which was this little baby, an infant, who was unbelievably malnourished. Mom couldn't provide any milk any longer because she was so malnourished herself. And it takes me back to seeing a young child when we were in Haiti at Mother Teresa's Missionaries of Charity orphanage in Haiti. And a little boy came. He was 4 years old, and he weighed 10 pounds. And the only thing he could move were his eyes. I've never seen anything more disturbing and shocking. And it kills me to imagine that here we are so focused on worshiping life in the United States while a death is running rampant elsewhere. Neal, what are your thoughts in terms of, scripturally? I mean, what biblically? I think one of the neat things about young people, millennials, you're right, very compassionate, concerned about not wanting to get the elderly sick. And I think that's wonderful. I think that's like my son's 22 years old. He came home with the coronavirus. He stayed in his room virtually for 14 days. He barely came out. I tried to get him to come out. I tried to get him to come out and go walking but he was so conscientious about not wanting to get other people sick. What a wonderful heart that is. But at the same time, we have this other major disaster. What are your thoughts on how we think about that from a biblical perspective? Our resident scholar from Biola Seminary, et cetera. So.
Yeah, I mean, scripture calls us to love the Lord our God with our heart, soul, mind, and strength, and to love our neighbor as ourselves. Those are the two greatest commandments. And so the part of loving God with our mind is, looking at the truth, looking at, the facts and weighing the different risks and ultimately not living in fear. Scripture tells us that we aren't given a spirit of fear, but of a power and of a sound mind. It uses that.
Yeah. And love.
Well. Yeah.
And love. Sound mind. Yeah.
And so we have to be able to, again, weigh these risks in order to best love our neighbor, to have the most pro-life policy, because ultimately scripture calls us to value life. It's not, we don't want to devalue some lives in order to save others. We want to have a policy, and we want to have a mindset which tries to weigh these different risks and, preserve life as much as possible, not only here, not only in the ones that are close to us, but, around the world.
Yeah. What are your thoughts, Dr. J, on just from a biblical perspective? How should Scripture influence us?
And this week I'm supposed to lead a study at my church on Luke 12. And there's a passage in Luke 12 about a rich man who has stocked up a huge amount of his grain in some barn or whatever. He's fully toilet papered up and ready to go, and he's protected. He knows that he has his faith in all that he's compiled so that he can live the rest of his life happily. And God says to him, "Look, you're a fool. Tonight you're gonna die." And he loses all of it. All of it goes to who knows where. Scripturally, we're called to lose our lives in order to gain it. If we hold on too tightly to our life, in a sense, maybe we'll live a little longer, but for what end? To what purpose? We're called to love one another and give up our lives for one another. And ironically, that's the key to actually gaining life.
Yeah.
So I think that's, to me, that's been part of my sort of value system all along. I think we have to think about others. I think it's good that millennials think about, everyone thinks about protecting other people. We wear masks. I think it's 90% of Americans are now wearing masks, in part because of the thought that I'm going to protect other people by wearing them. That's a good thing. We want that spirit of compassion. But just like Neal said, we want it informed by an even broader vision. How do we protect not just the people immediately around us, but people around the world? And sometimes that takes action that doesn't look like it's intuitive, but actually is really the most effective way to do that. Here, the most effective way is protect the elderly people as best we can, with all the resources and ingenuity we have, and then live our lives, again, with precautions as necessary, because that's the most effective way in some sense to protect other people.
I have to admit, sometimes I have a hard time with the mask requirement. And so I have to take a better perspective, because I get so upset with the fear mongering, and I just want to walk in and say, I'm not afraid. I'm not wearing a mask,
Well, I think like if you're alone outside jogging, why wear them? It just doesn't, there's no evidence that you're helping anyone.
Yeah.
If you're in a crowded situation and there are older people around, wear them. It may not be like 100% effective, but there's not a huge cost there. I think it's okay. I think if the cost of opening up is mask wearing, I think I'm okay with that. If the cost of reducing fear, but I think the key thing is, let's remember that our actions have these consequences way outside just our immediate circumstance. That's what I think we as Christians are called to remember all the time. Right? We're here for a purpose.
Yeah.
I just wanted to add on to that, going back to what you were saying, that we have to live in this tension where life has all this intrinsic worth and value because God created it that way, and yet at the same time, Scripture also says that our life is a mist. It's here one day and gone the next.
Mm-hmm.
In light of eternity, in light of where we stand before God, our lives are almost nothing. But God also created us to be here on this earth to live as embodied people. He gave us life as a gift, and we need to steward that well. And so there's, again, this balance and all these different things that we have to weigh.
My life verse comes from Acts 20:22, and it was the Apostle Paul, and in that era, he had his friends and associates coming to him saying, "Don't leave," because he's saying, "I want to go to Jerusalem." And he writes, he says, and see now, I go bound in the Spirit to Jerusalem. Another translation says, I'm being told by the Spirit to go to Jerusalem, not knowing the things that will happen to me there, except that the Holy Spirit testifies in every city, saying that chains and tribulations await me. But none of these things move me, nor do I count my life dear to myself, so that I may finish my race with joy and the ministry which I have received from the Lord Jesus to testify to the gospel of God's grace. And to me, I looked at that and I wrote in my Bible years ago, I wrote, wow, what, courage. And that is this idea that he says, look, I don't consider my life to such a degree that I'm not going to do what God's called me to do. And that's to testify to the gospel of God's grace. And that is actually physically to leave and go to a place he knows he's going to be put in jail. He knows his life is going to be at risk, and ultimately he's going to die from that. And anyways, I look at that, and that's kind of a verse that I look upon and just think to myself, boy, it's such an example of, boy, I don't want to consider my life dear to myself. We have so many people here in the United States that are suffering. The mental health risks are astronomical right now. The calls to suicide hotlines, what's happening across the world with the economic disaster and death occurring in the third world countries, especially, is because of our lockdowns here in the first world. It's just horrible. So I do agree that, boy, we need to try to balance it, but it's tough. It's a tough one. Doc, do you have any closing thoughts here?
I love that verse, Bob. I love that. I think that's one of my, I think often about that, about Paul sitting, talking to his friends. His friends are telling him, if you go to Jerusalem, they're going to kill you. And, the Holy Spirit tells him that, but he's like, look, that's where I'm called to go. So I'm going to go. We Christians need that spirit, I think. Everyone needs that spirit, actually. We need to take the risks reasonable risks that make sense, that boost up the lives of one another, right? In love. That's what Christian life, I think, is about.
Yeah. And not to worship life itself as a concept, but to worship God and live our life in obedience to what God's called us to do. And first, Dr. J, I just want to say thank you. But second, I want to ask anybody who's listening to pray for Dr. J, because here is a man who is standing up in great opposition, who is using his expertise and his studies to stand in an era, particularly here in California, to bring truth. And quite frankly, it's not popular at all. So thanks again for being with us. Neal, thanks. And boy, God bless you all.